You're listening to a Raconteur Studios podcast.
Welcome back to the After Hours Skin Clinic. I'm Dr. Emma Craythorne.
And I'm Dr. Ellie Rashid, and today we're heading south, literally.
We're talking about skin on the body and predominantly the bum. It's an area that we don't always talk about, but I reckon it's an area that lots of people think about.
That's right. So from bum facials to laser treatments to body contouring, the pursuit of the perfect peach is officially trending. But is it just about aesthetics, or is there more going on with the skin health too?
And then we're going to shift gears and talk about things that people are doing to their bottoms to enhance their bottoms, whether that's things like exercise or injections or body modification, BBL. So we can talk about the surgical side of things as well.
So whether you're all about bum beauty or just curious about post-surgery skincare, you better listen up.
Why do you think people have such a fascination with the bum, the bottom? What is it?
I think it probably stems from men being attracted to nice bums.
Because you always hear that comment, are you a boob man or woman, or are you a boob or bum?
Gosh, that's true, yeah.
What is Ollie? Obviously, you're perfectly assetted in both.
Obviously, both are perfection, but he's a bum man.
Yeah.
What's Neil?
Yeah, Neil's a bum man as well. In fact, our first song at the wedding was I See You Baby by Groove Armada.
Oh, I love that song. Shaking that ass.
So there is this massive attraction towards bottoms, but also I do think that over decades there is a shift and change of what is also fashionable. So I think, yes, that is a probably very primitive response to like a bum, but there's also this kind of fashion element assigned to it now as well, and a certain celebrity status with having a big bum.
Completely. And also, I think there's a whole trend towards, is it called bodification? Sort of looking after the skin on your entire body. So not just thinking about your facial skincare, but thinking about your entire skin. And sort of with that comes looking after the skin on your bum as well.
Yeah, because we see lots of conditions in the clinic where people have run into difficulties with their skin. Like the commonest thing probably you would see would be a folliculitis. You must see that in your clinic a lot.
I see it all the time. Yeah, I probably examine lots and lots and lots of bottoms. So I've got an interest in Crohn's disease, this inflammatory bowel disease, and that condition where people develop like lumps and bumps and spots in the genital area. And so I pretty much look at around 20 bottoms every time I do my clinic.
Well, I look at about 20 bottoms as well, but it's more from the skin cancer side of things. If you go to see your doctor with a mole, then really they should be examining all of your skin, every bit of your skin, and that includes your bottom. So I am looking at lots of bottoms as well, but for a slightly different reason.
What's so interesting? So I examined someone the other day and she didn't think that she was going to have a full skin check. It was for a mole check. And then she apologized loads, like, I'm really sorry, didn't shave. And it's so interesting how none of that even enters my radar. Like, I don't even think about cellulite. I don't even look at hair. All I'm really looking at is what I'm focused to be looking at, like abnormal moles, anything that looks cancerous, and then looking at the inflammatory skin disease that I'm looking after.
Exactly the same thing happened to me as well, just yesterday in clinic. So I'm really sorry I haven't shaved. I haven't shaved in a month. And I was like, I haven't shaved in about couple of years.
That's because you've had loads of hair removal done.
That's also true, but making people feel at ease. But let's have a think about the commonest thing I would say is folliculitis on the bottom, isn't
absolutely. it? Absolutely. Yeah. So when you've got this inflammation around where the hair follicle sits, so then you get these little spots and red bumps around where the hair follicles are, and people don't like the appearance of them, but sometimes it can be sore as well if you've got a big, angry, inflammatory spot bump on the skin. It can be sore and painful, and so people just want it gone and got rid of.
And then whenever those little folliculitis bumps leave, depending on what your underlying skin colour is, it can sometimes leave brown marks or red marks behind for quite a long time. So even whenever you've cleared it away, you've then got this kind of almost uneven appearance of the skin because of that colour difference. So I suppose the commonest way of treating this really, I normally tell my patients, is to use, I love Dermol 500. It's quite nice and easy to get a hold of. And I'll often tell my patients, just try washing with this in the shower as you wash in that area to see if that's going to help. If you've not tried anything at all, it's a very easy thing you can just pick up off the shelf and try. And then it's even things like the tightness of the clothes that you're wearing, because I'll see this a lot in people who go to the gym trying to build up their bum in other ways. But that tight kind of lycra against the skin also can be part of the cause of this appearing in the first place.
My favourite wash is Octenican.
I know you love that.
I absolutely love it. So it's another antimicrobial wash. But the reason why Dermol I'm not such a fan of is because even though it's great, it's got wonderful properties, really good anti-inflammatory, antimicrobial properties, it doesn't froth up. And so it's like a creamy consistency. And sometimes people find that creamy consistency, they don't feel like it's sort of fully clean. So Octenican does froth up, and so you've got a bit more of a sort of cleansing experience from using it.
Whereas I like the moisturising effect of Dermol 500, but we're both right.
Yeah. One's more right than the other.
I know, but I wasn't going to say that. So that's the probably commonest thing that we think about on the skin of the bottom. What else do you typically see?
Oh, I mean, buttony, we've not talked about. So there's folliculitis, and then some people develop really blocked, clogged pores on their bottom with lots of blackheads and comedones.
Is that hidradenitis suppurativa? But
sort of is a part of that, severe acne, HS. So HS is that inflammatory condition where you develop spots, blackheads, pussy bumps, and these pus draining tunnels can affect your bottom as well. And so I see loads and loads and loads of that. And so in the patients that I see that have that, and HS is more common than people realise.
Yeah, really common.
Initially, we thought it just was a rare condition, but actually it affects 0.77% of the UK population. Actually, it probably affects more. Yeah, we think it's more close to 1 to 1.5% of the UK population. But most people haven't heard of HS, but most people have heard of psoriasis. And psoriasis probably affects about 1.5 to 2% of the population. So it's definitely common. But blackheads in that context often need something that's prescribed, so a treatment that's prescribed. So we use things like tretinoin on that area just to help exfoliate the skin, increase skin cell turnover, and unclog some of the pores that are getting clogged up there.
And 20% azelaic acid.
Yeah, we use 20% azelaic acid as well. Usually
there's some good formulas that combine the two of those together, isn't there?
Yeah.
A plug for Clear.
Clear for everything.
Clear for everything, even your butt.
God, can you imagine?
I actually do have patients using their Clear formulation on their bottom. I have quite a few of them.
Too.
Yeah. Because, that's their pride and joy, really.
And then I normally say do it in the order of face first, then bottom.
Yes.
Yeah. You don't want to be rubbing your hands
for
all over
cleanliness
your bum
reason.
and then rubbing on your face.
When we think about the bottom, we've got the muscles within the bottom, we've got the fat overlying that, and then you have the skin. So when people are in pursuit of the perfect bottom, the thing that's noticed first of all really is going to be the skin. So what other things do people do to help the skin on their bottom? Keeping it well moisturized, I suppose, is going to be one thing. Stopping any skin issue that might be there, like HS, acne, folliculitis.
I mean, other things that you'd want to do is if you've got a condition like eczema or psoriasis or an inflammatory skin condition, you want to just make sure you're treating that adequately. So moisturising well, using a soap substitute, so not using something that's going to dry things out further. Well, Hibby Scrub's the worst.
Hibby Scrub is the worst.
Hibby Scrub is the antimicrobial wash that people will use and just dries everything out. So yeah, I like Hibby Scrub for some reasons, but definitely not in the pursuit of perfect peach.
So what else do people do for the skin on their bum?
Some of the things that people can do are chemical peels and exfoliative treatments on their bottom. And we haven't talked about a condition called keratosis pilaris, which is very common. And that's where people have this sort of sandpapery, rough textured skin, usually on their thighs, bottom, upper, outer arms. It's usually genetically driven, and it's just where you produce more keratin around where the hair follicles are. And so it gives you like a rough appearance. Tends to be better in the summer months, a little bit worse in the winter months. And you usually use a keratolytic ingredient like urea or lactic acid or something like that, just to smoothen out the rough, bumpy strawberry skin, it's sometimes called. So that's a good way to just improve the appearance of that and a good moisturiser.
Have you seen that you can get like bum masks?
And bum facials? Bum
facials?
I think they're called facials.
Are they actually called facials?
Yeah,
Have you had one?
Of course not.
How do you know what it's called then?
Because I'm so on it with trending social media.
So what does a facial involve?
I think it just involves putting like these collagen sheet masks and things over your bottom area.
So, I mean, you could then typically do this with any of the ones that you would buy to put on your face, but you just put them on your bum instead.
And then instead of having 2 holes, it's just got one hole.
You just need one hole. Yeah, but you'd still be like off center a little bit. Actually, no, it's for the nose. You could put the nose over the very central hole on the bottom.
Yeah, and then just have a little gap on each bum cheek and at the bottom. Perineum skin.
So if you were going to do that, then let's have a think about the facial mask that you can buy just over the counter that would be okay to put on your bum.
So any of the hyaluronic acid masks, easy, done.
Unless you have acne, I wouldn't put any of the acne masks on your bum because it might be a little bit too drying.
And also the perianal skin is quite different to the bum cheek skin. And so you want to be a little bit careful with what you're applying to that perianal skin that feels quite different. It's a different type of cell sort of lining. So you just want to keep on the surface of your bottom rather than doing anything.
Yes, because if you can imagine
internally.
having an kind of alpha hydroxy acid fruit acid mask. These might be masks that have things in it like papaya or pineapple, which is pretty good at almost kind of exfoliating the surface of the skin, but used on the perianal skin, which is more of a mucosa kind of skin, it's going to sting.
Ouch.
A lot.
Have you ever used the hair removal creams, like the Veet hair removal creams on your
Yeah,
bottom?
but years and years and years ago.
Laser hair removal.
Laser hair removal everywhere. It's like all of the nurses in our department, everyone has just got no hair anywhere now.
How on earth have I not had mine done yet?
You were only in our department for maybe 3 months.
Yeah,
You
4
need
months, yeah.
a year and you're done.
Working hard.
Yeah, exactly.
I was genuinely working really hard. Didn't have time to get my laser hair removal done.
Anything else you would say about the outer envelope of the buttocks in pursuit of the perfect peach?
Well, I was just thinking, now we've got treatments like the little spicules to try and induce new collagen and try and really build up collagen in your face. You know, the little like topical spicule treatment. I sort of think, why couldn't you really use that on your bottom as well?
You could do. Yeah, definitely.
I don't think there's many things that you couldn't really use on your bottom that you would use on your face. Apart from really respecting the perianal mucosal skin, I think everything else on the rest of your bottom, I couldn't think of anything that would be that much of a problem.
No, unless something that might dry the skin out on the bottom a little bit more.
Yeah, and we've got less oil glands on our bottom, so you don't want to dry things out too much. On our face, loads more oil production, loads more sebum, lots more density of oil glands, but far fewer on your bottom.
And then if we think about the next stage down in the bottom, whenever we think about people trying to modify it and make it a little bit bigger, should we talk a bit about things like that, about injections that you can have in that area?
Yeah, so I know that people have had filler injections into their bottom to volumize their bum.
The brand name of it is something called Sculptra, but it's poly-L-lactic acid. And we use that to inject just under the surface of the skin, and it induces a collagen response. So you make the skin thicker. And it's used on the face areas for volumizing, but it actually makes the skin itself kind of stronger and thicker. And so where on someone's bottom you might have little dimples that are appearing or kind of dips going in, you can use Sculptra to inject into these areas to stimulate collagen at that side. It's got an FDA license to show it's safe to do in the right hands. And it does give a really nice result. It takes about 6 months after the injection until you see that good result. And it is a bit of a builder. It doesn't do anything to add volume to the bottom. It doesn't make the bottom really any bigger, but it certainly makes the kind of roundness of it smoother. So I think that is different to something like a BBL, so these Brazilian butt lifts, which are taking fat from your own body and re-injecting it into the buttock. And that is something then that does make the bottom bigger. It does volumize the bottom, but it's really pretty risky procedure. taking fat out and putting fat into somewhere else is risky in itself, but particularly into the bottom where there are lots of large veins, and particularly if you were injecting into the muscle or deep to that muscle, there are a lot of very worrying veins in that area. And then the big risk is of a fat embolus. So you inject the fat, it doesn't go into the bottom, it goes into a vein, it then transfers to the lungs, and in the lungs it causes catastrophic destruction and is associated with death. And it was as high as 1 in every 3,000 procedures had that mortality rate. Like, that is really, really unacceptably high. But then they did a huge big review of this to see, why was this happening? And it was really all boils down to injection technique. So now, in the right hands, with the right practitioner, and usually with ultrasound guidance, injecting fat from other parts of the body into your buttock in the right place is much safer. And the mortality rate is now about 1 in 15,000. And that's about the same as having a tummy tuck or something like that. So the mortality rate is equivalent. But done in the wrong hands, it is absolutely catastrophic. And we've seen that in the UK. There was a case not that long ago, and it's just simply fat put into your vein, makes its way to the lungs, and unfortunately often results in death as a consequence.
Did she have a fat?
She had a fat embolus, yeah. A young mother with
young
5
mum.
children, yeah. So that is a very worrying case. And even the tourism abroad, the riskiest procedure are these Brazilian butt lifts where the fat's being transferred in this manner, and they're perhaps not carried out in these very super strict ways. I mean, even there's a limit to how many you can do in a day. You're only allowed to do 3 in a day so that there's no fatigue-related errors that occur.
The practitioner's only allowed to 3 a day.
Yeah.
But it's so unregulated. So how are they policing that or controlling that?
So this is data from the US. I don't think the same thing's happening here. I mean, you can go and get a BBL
exactly.
in the back of someone's house. You can just go and get that done. And no one's there telling you can't. And in most cases, it's okay, because in 1 in 3,000 cases, but one of those 3,000 cases, it won't be okay. And
I would just never, ever, ever take the risk.
It's absolutely terrifying. I mean, I have so many friends who are plastic surgeons and undertake these kind of procedures, and it is well known that nobody would ever do that without being in a proper hospital, with the right equipment.
Totally.
It's really terrifying.
And having the supporting staff, having your assistant who's medically qualified or is a qualified nurse that can assist you in a safe, clean hospital, theatre environment. I mean, I wouldn't even do something like that if I even could do something like that. But I wouldn't even do something like that in a clinic room. I would reserve it for a theatre room. Then you've got people that are just doing it in the, conservatory of their house.
Yeah. So to be quite clear, the differences between the BBL, which is this transfer of fat, or these Sculptra injections, which are just going into the skin. And that is a very safe procedure when done properly. I'm very comfortable doing those procedures, but these true BBLs that are adding lots of volume, absolutely no way. I mean, there was a lady who was delivering these in her beauty clinic. Yeah.
The
confidence of it. And she wasn't using fat. She wasn't taking fat out and putting fat in. She was using something called a biocollagen, which was all the rage in Colombia for a while until it ran into a whole lot of issues.
This silicone product.
Yeah. And she had injected into a patient who came to see me for help because it had all gone wrong, 1.5 litres of this biosilicone collagen into this woman's bottom. The woman couldn't sit down. Absolutely couldn't sit down. 1.5 litres. It's absolutely crazy. One of the other ways then to build actual volume is to build out the muscles. So the muscles in the bottom are your gluteus minimus, maximus, and medius. And by building those muscles out, that obviously increases the size of the bum in general, and particularly the roundness and kind of pertness of it.
Yeah, the shape of it.
You can almost tweak which muscle you want to work out to determine which angle of projection you want the bottom to go. So your gluteus medius will give a projection in one way, which would be slightly different to the gluteus minimus. And so it's been able to work out all of these muscles in general can kind of help to shape that. And so there's lots of personal trainers who really will just focus a lot on this. And actually in the world of Pilates, which you know I'm addicted to.
Addicted to you are.
It's exactly the same thing. So sometimes you will just work out your gluteus medius, and then there's certain exercises like lying on your side and having your legs in a clamshell and lifting up and down with resistance is working that particular part of it.
Which gluteus are you working on at the moment?
I did my medius last night, actually. That's why it was in my head. And it's rather sore today. But just
Extra cushion underneath you.
Yeah. But just gradually increasing that resistance, then that will obviously increase the volume then of the bottom. But there are machines that you can use to cheat that.
Oh, I want the machine. Can't be bothered. Just give me the machine. What do I do? Just sit on it and it vibrates or something?
Yeah, so it's a machine called an M-Sculpt, which is the brand name of it. And they essentially attach like pads to you, and then they work out those muscles like super quick. And that workout causes a hypertrophy of the muscle, which I think from memory is about 15% after they did it after 2 weeks, and you had to maybe have the treatment a few times a week. But it was about 15% increase in the muscle growth in quite a short period of time.
That'll be me.
It's taken me 2 years to do that 15%.
Tick, Ellie done in 2 weeks. Emma going to Pilates every day.
But you do have to keep it up, because otherwise, like anything, if you don't use it, you'll lose it, and then it'll start to shrink back down. So it might cost you an absolute fortune, because it's not cheap.
And none of the other health benefits that comes from exercising.
Exactly.
I mean, who cares about those?
But then you'll get to the pub much more quick.
Yeah, exactly. I haven't got much time, Emma, at the moment. Literally, it's like efficiency. Hopefully M-Sculpt will do it within 3 minutes. Get a nice 15% increase in my bum muscle mass.
So I think they're the only things I can think of for actually adding volume, the BBL or the exercise. And the exercise has lots of other benefits. So that's where my vote is. Laser for the bum. I mean, why would we use a laser? We're going to use a laser because something's red or something's brown. So if you've got something red or brown, yeah, you could use a laser on it. I have done some laser for areas of hyperpigmentation on the bum after folliculitis. And I've done some lasers for birthmarks, obviously in the bum, they're bright red. So for those reasons, I'd say yes. I'm not doing any CO2 resurfacing of the bum.
Why not?
Just the slight worry it might not recover.
Give the people what they want, Emma. I guess something like the Ultra, I can't imagine that being a major issue on the bottom.
The funny thing is, whenever you're doing laser on the bottom, so sometimes I've done carbon dioxide laser on the bottom to try and treat, well, you might do it for viral warts that have come in the perianal area, or for skin tags in the perianal area, or little benign growths in skin tags. But the thing I always find really quite funny in this instance is that you always have to put a moist gauze over the opening of the anus. Because if somebody was to fart, you can generate a flame with the carbon dioxide laser. So, you know, people might forget that that's actually a reality. So don't just throw caution to the wind and do it without it. So, yes, so I do use a carbon dioxide laser on the bum, but it is usually just to remove lesions.
I can see us heading that way. I can genuinely see us using all the microneedling radiofrequency on the bum.
Well, I mean, yeah, yes. Maybe if somebody's lost a whole lot of weight and they've got very sagging skin. But I mean, even then, I'm not convinced entirely of the merits of it unless you're going to do hundreds and hundreds of treatments. LED light therapy, can you do that in your bum? I mean, yeah. Why would you want to? Imagine sitting there. I mean, it's bad enough if you go to someone's house and they've got the LED mask on their face. Like, imagine they strap their mask to their butt. They're walking around.
But in clinic, you know, they've got like that arch-shaped LED in clinic.
Yeah, in clinic.
So then you can just line your front and have it over your bum.
I know, but really?
I don't
I'm
think
here
you're giving
for my
enough
butt
respect.
LED.
Yes, I'm here for my bottom LED light, please. Thank you.
I don't say. Would you do it? Have you got an LED mask or light?
No, I don't. I had one. I gave it away.
Yeah, I've had a couple. I've given them away. No time for that.
No,
if you've no time to do Pilates, you definitely no time for that.
Absolutely no time for that.
You could combine your LED mask with your M-Sculpt to get you 3 minutes in that way.
honestly, on social media, they do the whole like where you wrap up and then there's like the morning shed. I think that's going to be me. Like LED mask on my face, on my bum, the little pads with the M skull. All a go.
Oh dear, I would like to see that. So what would you say that your kind of top takeaway is for looking after your bum?
Moisturize it and use a soap substitute that's gentle on your skin, so not dry things out.
Mine is come to Pilates with me.
Just be to moisturize and use a good cleansing wash, something that's suitable for whatever your skin concern is. If you've got dry skin, use something hydrating. If you've got a sort of acne prone, folliculitis prone skin, then you might want to use something that's got an exfoliating agent in there, like a beta hydroxy acid like salicylic acid or one of these alpha hydroxy acids.
I love the CeraVe SA smoothing cream. So I think for somebody who has keratosis pilaris, which is the little bumps on the skin, or you feel your skin's that kind of, it's dry but a bit bumpy, I think go for that CeraVe SA smoothing cream. So it's a big tub, just as you would have your normal CeraVe cream. It's a bit kind of even more moisturizing, I think, than their normal cream, and it's got SA in it.
Well, they've got their cleanser, which I really like.
The cleanser's nice. This is better.
Yeah.
In fact, I had it on my skin at the weekend, as did Florence, in Portugal, and we jumped in the swimming pool, and we was like, this water in the swimming pool is amazing. It's like, I don't know, it's like velvet or something. And then Florence said to me, do you think it's that cream we have on? Like, that's what it was.
My skin's gorgeous.
Yes, exactly. So my top tips are, I am very wholeheartedly going to recommend the SA Smoothing Cream. You get it in a big tub, slap it on. That is brilliant. And for the wash, Dermol 500 or Octenican.
Octenican, please.
So I think in pursuit of the perfect peach, it's about thinking about the bottom in different layers. It's about what you can do to that surface on the skin, what you can do in terms of building up the muscle that's there, and then other little techniques that you can do if there's things like dimplings getting involved, but also really importantly the things that you shouldn't do.
Yeah, so we need to think of the skin on the bottom as separate to the skin on our face, and also it has less oil glands, so it will just recover in a different way depending on what you might do to the overlying skin.
We hope this episode helped shine a light on an area we don't usually talk about, although we do talk about it quite a lot sometimes.
more than other subjects. And if you've got a question about your body skin or something that you've tried that works wonders, then let us know. We're always up for listener stories and tips.
And don't forget to rate, review and subscribe wherever you get your podcasts. It really helps others discover us. Okay, that's bye for now. Take care of yourself and your skin, and don't forget to wear your SPF.
And see you next time at the After Hours Skin Clinic.
As always, this podcast is for informational purposes only and is not a substitute for medical advice. Please consult your healthcare professional before making a change to your treatment.